Now, scientists announced at the weekend that the highly transmissible Delta variant that is driving the pandemic in India is becoming dominant in South Africa and has been detected in 5 provinces. Since the beginning of the month, the number of active cases in the country has increased dramatically. What lessons can we learn from India about the Delta variant? We are now joined via Zoom from New Delhi by Dr. Anant Bhan, bioethics researcher and health activist. Dr. Bhan, thank you so much for your time this afternoon.
For having me.
Dr. Bhan, now we know that the Delta variant spreads more easily. What else do we know about this variant?
Sure. So, as you're rightly pointing out, as compared to the wild original virus and also the alpha virus, the alpha variant virus, which was spreading predominantly last year. This year, we've had the Delta variant come through, and it's actually the cause, perhaps, in some ways, for the rapid rise of infections in India and now in many other countries. The Delta variant, as you're rightly mentioning, is certainly much more transmissible. But what is also worrying about this particular variant is that it perhaps leads to more hospitalizations, especially in those who have not received a vaccine. And in those cases where there has been vaccination, there are chances where there can be vaccine escape, especially for those individuals who might have received just 1 dose of the vaccine. And lab studies also indicate that if you've had coronavirus infection in the past and you've had some antibodies because of that, even with that, the Delta variant might end up causing a reinfection. So clearly the case that because of the increased transmissibility and also the chances of higher disease severity, that it is a cause for worry in many countries now.
Now, I know that you said that it is more transmissible and it leads to more hospital stays, etc. Is it more dangerous? Does it cause more severe symptoms?
Well, the experience in India with the second wave seems to indicate that, it was, of course, much more severe than the first wave, and the Delta variant was a significant contributor to that. So, we should tend to assume that there is a cause for worry in terms of the hospitalization. That having been said, I think, the precautions remain the same. The only thing being people should not feel complacent that just because they've been vaccinated, they might be protected, because the Delta variant clearly indicates to us that not just vaccination, but continuing usage of masks is extremely important. And also because the vaccine efficacy for the vaccines which are being widely used across the world is relatively lesser for the Delta variant as compared to the earlier variants.
And now, Doctor, South Africa has just confirmed that the highly infectious Delta variant of COVID-19, the one that we're obviously talking about today, is likely behind the current surge. Reports from India officials this week have revealed that you have another variant, the Delta Plus, had been identified. Let's zoom in your country now. How different is this variant from the Delta variant? And should South Africa be concerned that this possible variant or Delta Plus could be another variant that just springs up in the country?
Yeah, so I think the lesson there is that all of our countries, including India and South Africa, need to do good quality and rigorous genomic epidemiology. And if you do that, then you pick up on variants like this. So the Delta Plus variant, as you're rightly saying, is the Delta variant, but with the mutation, the K417 mutation. The number of cases so far in India is relatively lesser. It's not too high. It's only been reported from a few states. But it's important to keep track. What we know so far from these limited number of cases is in those individuals who had this infection but who had been vaccinated prior to that, the likelihood of severe disease and death is much lower. And if they were unvaccinated, then the likelihood of severe disease and death is higher. So it doesn't seem so far that this is a new variant of major concern, very different from the Delta variant by itself. But clearly, the lessons are around the need to ramp up vaccination and to keep a close watch on the development of these variants by doing good quality genomic surveillance.
Now, in South Africa, we've introduced, several lockdown regulations, and one of them is intra-provincial travel. So, in other words, not allowing people, especially in this province that I'm currently speaking from, to travel in other provinces, likely to contain the virus. What are some of the learnings that we can take from how you have dealt with it in India as it speaks to, just intra-provincial travel or regions travel?
Sure. So I think India also learned the hard way. We last year did a very extensive and long, rigorous lockdown, which was national in nature. And unfortunately, those kind of lockdowns can have negative consequences from an economic perspective, from a hardship perspective. So I think the lessons which have been learned also in India is that perhaps the use of lockdowns should be selective, and they have a clear rationale and a utility, but they should be used perhaps in micromanagement. So lockdowns which are more local in nature and which are very focused in areas where you're seeing a collection of cases, a clustering of cases is more useful. Having en masse lockdowns across the entire state or across the entire country are not as efficacious and might end up having more harm for the general public because of the inability to carry out normal economic functions.
Now, in terms of having, two variants in one country, I know we've seen other countries also have it. We know that the Delta variant is also prevalent in about 85 other countries, so South Africa is not unique to it. But what do we know about countries that have two variants or even more variants, and how those countries are dealing with it? Is vaccine or vaccinating the population the only answer?
Well, certainly vaccinating and vaccinating fast is a major intervention. The more you vaccinate and the higher coverage that you have, the more likelihood that you will be able to reduce disease severity as well as death. It certainly also is more protective and protects not just against the older variants, but the newer variants. So I think the lessons are quite clear there. But having said that, I think the experience in countries like Israel also shows that even if you have high vaccine coverage, if a new higher transmissible variant comes through, then there can be risks if people stop taking precautions too early. So the lessons are that, yes, please vaccinate and vaccinate fast, but let's not stop adherence to measures like masking very soon. Let's wait for a while till, of course, the pandemic subsides significantly before we do anything like that.
All right, Dr. Bhan, I thank you for your time and coming out and just explaining in detail about the Delta variant. We thank you so much for your time. All right, that was Dr. Anant Bhan, bioethics researcher and health activist, speaking to us there from New Delhi.